Now that you've had a chance to watch the exercise videos to do with your dog, I want to give you some tips and tricks on how to actually do them, not necessarily perform them, but how to integrate them into your daily lively plan. So a few things to consider is not every dog is going to be able to do all of the exercises all the time on a daily basis. And if you think about yourself, you don't want to necessarily go to the gym every day, but you do want to go to the gym several times a week. So I would say, start lightly and then kind of progress as your dog improves. So some things to consider is that you can start with maybe just 2 to 3 reps of every exercise if they're able to do the exercises, and then slowly progress them from there. Some things to look out for are definitely panting. So we want to make sure that it's okay if they pant during an exercise. We want to make sure that they're not over panting, over exerting themselves, getting too tired, especially with GOLPP. See if they're panting prior. If they're panting prior, then maybe let them rest for a little bit. As you start to do some exercises, it would be normal for a dog to pant during physical activity. That's okay. We just don't want them to be overexerted. So a normal pant, we don't want to hear a lot of that noise, upper respiratory noise that you hear with them when they have GOLPP. So we want to make sure that we don't push them to the level where they're getting kind of more progressive respiratory symptoms. They can have a little panting, but you want to make sure that their tongue is nice and pink, reddish, but not purple, not pale. So look for those signs, and also look at their eyes. Their eyes will tell you if they're tired. So if their eyes are nice and wide open, they're comfortable. As you start to go through the exercise, if you see their eyes start to squint, especially on the outsides, then that means that they're getting tired. So you can stop and rest them there. You can provide water throughout the exercises. Just make sure that you're providing in a safe, elevated manner so they're not swallowing the water, especially too quickly, because if they're thirsty from the exercise, they're probably going to want to drink more water than maybe they would on a normal day. So those are some things to look out for. As far as how often to do these exercises, it really just depends on your dog's individual strength and where your dog is today. So I would say start today with a couple of the exercises. Maybe pick 2 or 3 to start with. The first ones that we started with, start with those and see how your dog does. Then the next day, see how your dog does when you just go for a normal walk or while they're walking around their home. If your dog starts to look a little bit weaker than they did yesterday, then that's a rest day, and then you can try again the 3rd day. So I would definitely probably not do daily. I probably wouldn't even do every other day. Maybe just do 2 or 3 times a week. That's probably a reasonable goal for a patient with GOLPP, but maybe even once a week. So as your dog unfortunately will progress with the condition as they get weaker, then we might have to back down a little bit or provide more assistance. So more use of towels, more use of the leash, more use of support blocks or things like that to help them.